Functional medicine has emerged as a powerful approach for those who are dealing with chronic gut issues, but it can be really overwhelming at first. So where is the best place to start? As many of us at one point or another in our lives have experienced, a traditional medical workup is often really focusing on alleviating the symptoms at hand, especially gut issues. And while this type of workup is incredibly important, especially during acute medical crisis situations, oftentimes we're just placed on medications that over time, if we ever try to come off, those symptoms can reemerge and they can persist, which keeps us back on those medications. And sometimes those medications even create side effects which warrant further medications to manage those side effects and so forth. And this is often known as what is called the medical vortex, which we just end up getting into a vicious circle, and we want to sometimes be able to break free of that. And so what many patients have come to see me for over the years is to get a deeper understanding as to why their symptoms are happening and what are the underlying imbalances that might be involved. And this is really where functional medicine has a tremendous amount of potential. As a board-certified functional medicine practitioner, I've literally worked with thousands and thousands of patients over the years. And they've often come to me with a myriad of different complaints, whether it's autoimmune disease or diabetes or heart disease, cancer, or different types of mental health issues, and of course, many different types of chronic gut issues. Now, many of these patients before seeing me have been to 4 or 5 or even upwards of a dozen different doctors before they've explored the functional medicine approach. Now, where the real value of functional medicine is and what I really get passionate and excited about is the in-depth analysis that we can start to do in some of the areas that are critical to achieving optimal health and wellness. Whether we're looking at nutrient panels, whether we're looking at different types of comprehensive hormone panels, or gut microbiome assessments, SIBO assessments, intestinal permeability analysis, different types of toxicity analysis, molds and heavy metals, for example, there's a number of different tools that we can start to harness to really uncover the story as to why somebody is feeling sick and unwell. Now, while this is very exciting for virtually every new patient that comes in, it can often be very overwhelming. And so, to avoid the overwhelm, there are 3 very essential tests that I would focus on starting with your functional medicine doctor. Number 1, a comprehensive digestive stool analysis. And this can often give you an idea of what you're looking at because it's upwards of 5 to 6 pages in terms of the report, much different than your traditional stool test. Number 2, a comprehensive nutrient analysis. And again, we're going to be looking at a number of different nutrients here, upwards of 40 different nutrients in certain panels. And doing this in a very in-depth way using an intracellular analysis is going to give us a broader reach of the last 6 to 8 months. Number 3, a comprehensive hormone analysis. And this is very different than a typical blood test. This is often in a urine test that's going to give us anywhere from 5 to 6 pages, upwards of 20 pages of information depending on the panel that's run. And if you do those 3 tests, that's going to give you a huge starting point. So find somebody in your area that can run those for you, and the data you get from that will be invaluable. And that's going to be so important for you, not only to get your gut health to where it needs to go, but many other levels of your health will benefit from this when you just start with those 3 tests. So for more tips and free guides, please jump over to thehealthygutinstitute.com, and I'll see you at the next video.